Hello, I am Rosa Reina from Argentina, President of Argentinian Critical Care Society, SATI. Since November, we are in the social distancing phase when a slight drop of cases was seen between October and November. Unfortunately, this decrease is very significant because we are still maintaining a high plateau of cases, around 5,000 per day. And since December, the cases has slowly begun to increase again, a regrowth, in the middle of holiday days and with some massive events taking place. We still have between 50 and 60% of our ICU beds occupied. On the 29th December, a massive vaccination campaign with the Russian vaccine Sputnik V has been begun here in Argentina, being healthcare workers the first to be vaccinated. The last report today, the 3rd of January, in related with mortality rate, put Argentina in the 10th post in the world and 3rd in Latin America, and in the 11th post in the world in cases that are increasing right now. The current situation in Argentina has been dramatic, with cases increasing despite being in summer, as well as the ICU beds occupancy, with healthcare workers tired, exhausted, taking a few days of holidays. People relaxed, many are reluctant to continue with the protocol measures. The health team, especially intensivists, exhausted, feeling that we are losing the battle against this pandemic. Really, our situation right now is dramatic. Many things.
I'm Heatherlee Bailey, an emergency medicine intensivist at the Durham VA Medical Center in Durham, North Carolina, USA. North Carolina, early in the pandemic, had done well compared to other areas of the United States, I think because we had a relatively early stay-at-home order. Unfortunately, the last month, our numbers have skyrocketed, as many other areas across the country have, and on the beginning of 2021 actually has been our worst numbers ever. My system, just as many of you, have been challenged with PPE. Gloves currently are our big issue. And staffing, we've had trouble staffing. Some clinics have been closed, some floors have been closed. We've had multiple staff out with COVID. I think there are many lessons to be learned from the pandemic. I think one of the most hopeful messages is that when faced with a worldwide pandemic, as we have been, the scientific and medical community have come together to share knowledge and information so that we may better care for our patients and each other using technology and social media. I look forward to the day that we can meet again, which will hopefully be sooner rather than later, where we will share stories, laughter, and I'm sure some tears. Until that time, good luck and stay safe.
Hi, my name is William Rodriguez. I'm the chief of the SCCM accredited critical care medicine training program here at the VA Caribbean Healthcare System in San Juan, Puerto Rico. COVID in the ICU has really been a growing experience for us. First, has created a big demand for ICU services, making hospitals administrators to have a more clear vision of the value of critical care medicine in saving lives. Also, it has strengthened and stimulated the creative multidisciplinary roles of critical care medicine, medical and paramedical personnel, not only in our center, but also across the whole island and across the U.S. Third, finally, COVID has made us more aware of what is fatigue at work. But you know what? Our resilience will prevail at the end of everything. Have a happy holidays, you all. Thank you.
Hello, I am Dr. Manuel Bello, intensivist and head of the intensive care unit of Hospital El Salvador from El Salvador, Central America. Our country was affected not only in the health of the population with a relatively high mortality of the elderly and comorbid patients who acquired COVID, but it also affected the economic area, especially employment. There were also political disputes that prevented the rapid implementation of pandemic containment plans in the country. It affected our work because it showed us that there were not enough beds and intensivists to attend these patients, neither in my hospital nor in the country. However, this caused the current government to invest in the construction and equipping of a hospital for more than 1,000 patients. And one of the lessons that this pandemic leaves us is that our health system are not prepared for the adequate and timely care of patients with disease such as COVID, and it is necessary to prepare more intensivists because this situation has shown that there are not enough to attend an emergency as this or others similar to it. Thank you.
Hello, my friends. I am Juan Ignacio Silesky-Jimenez, intensivist for the Caja Costarricense del Seguro Social and CIMA Hospital in San Jose, Costa Rica. The COVID-19 pandemic produced a negative impact on our country and the Central America region, such in several spheres, such as the economic, social, and personal for all the people. It represented a big challenge for our organization, the Caja Costarricense del Seguro Social, and many private hospitals, in order to maximize resources and provide quality of care to our patients. The lesson we have learned is that this pandemic is fought from homes with a good care practice, and the health system can get ahead with the work of everyone, from the cleaning personnel to the professional personnel. Thank you for your attention and my best wishes for all in 2021. Thank you.
Hello, my name is Tim Ellender. I'm an associate professor of clinical emergency medicine and critical care at Methodist Hospital, Indiana University Health in Indianapolis, Indiana. COVID has impacted both myself and my colleagues significantly in the state of Indiana, as we have had some of the higher numbers in the Midwest, specifically because of both my emergency medicine and critical care ties. I've been pulled in several different directions to try to help mitigate the inpatient volumes that we've seen. I've been blessed that my emergency medicine colleagues have allowed me to sort of move a lot of my emergency medicine time into the critical care units in the last few months to help on our COVID impacted units. And so I've had a significant shift in, I guess, my day-to-day job sort of opportunities. And as part of this displacement, have learned a lot from my colleagues. COVID has been significant for the population in Indiana. We have had a large percentile of our population, 70 plus years of age, be impacted by COVID, and as a result, we've seen a significantly higher death toll, especially in the fall, as compared to what we saw in the March-April period of the early 2020 sort of pandemic wave. So we have learned a lot from this in regards to how to sort of understand people's progression, learned a lot about trying to avoid intubation, especially in the second wave, and then more importantly, how better to sort of predict who is going to need advanced therapies like ECMO versus basic bedside therapies like high flow oxygen and non-invasive ventilation. So COVID's taught us a lot. We do appreciate SCCM. They've done a lot with regards to getting out information from a global sort of perspective, especially in their webinars and in their communiques. So we do appreciate a lot of what SCCM has provided us in a day-to-day sort of information link. So thank you.
Happy New Year to you all. The year 2020 was full of mysteries. COVID-19 created many challenges and a lot of opportunities. The response of clinicians and researchers has been impressive. The crisis triggered collaborative efforts to develop and implement treatments and vaccines. The fight against COVID-19 brought untold misery. It brought the world to a halt. But then it also showed what we can achieve if we work together. Healthcare workers were at risk on two fronts due to the shortages of PPEs and some consumables for hand hygiene. Some were being infected in care facilities, while others were infected from their homes and communities. Nigeria's fragile healthcare system, that is in shambles. In fact, COVID-19 was the last straw that broke the camel's back. It brought the true realities on ground to the forefront. And now we will be able to build a more resilient healthcare system. The challenges were enormous with dilapidated facilities, infrastructures that were very weak, manpower shortages, insufficient resources, poverty, ignorance, poor water and sanitation, poor hygiene, densely populated housing, all of those, and then lack of governance. The biggest lessons we learned were perseverance, resilience, and togetherness. My name is Halima Salisu-Kabara from Kano. I'm a critical care nurse manager, the Vice Executive Director of African Sepsis Alliance from Nigeria. Thank you. Bye.
Hello everyone. I am Dr. Yash, intensivist from Regency Super Specialty Hospital, Lucknow, India. COVID-19 is a mega pandemic, if ever there was one. The impact has been widespread. We were forced to learn new lessons and rediscover the value of some old ones, much to our chagrin. COVID has hit India very hard. It has exposed inequalities. The gaps and heterogeneity has been widened. India is recognized as land of diversity. The impact of COVID-19 has been diverse and countless. But if we see the other side of reality, COVID-19 has impacted our society, that is for sure, but only adversely. The time will tell us. Despite being in a resource-limited region, we have fared reasonably well in our fight against COVID. The impact on education, employment, commerce has been very, very cruel. Healthcare organizations, like all other sectors, have faced the financial burden. It was a multi-edged sword for us. Decreased admissions, healthcare provider fatigue, demotivation, dejection, interference were the major setbacks. We overcame all that. As an individual, I tried to change for betterment. I was more forthcoming to my family and patient needs, either virtually or physically. It was a time to make new bridges with fellow colleagues worldwide. Telecommuting and global networking become possible. The saying, "we are in this together," has never been so real. We fought the virus as family, neighborhood, country, and most importantly, as intensive care professionals. They say, never waste a crisis. We wouldn't have wasted this one if we start building and adapting solutions to stay humane. My lesson for life is, I really don't need much to live. Minimalism has come to define my lifestyle. Minimalism's core belief is that more is achieved with less. I will end with this saying: perfection is achieved not when there is nothing more to add, but when there is nothing left to take away. Thanks and stay safe.
Hello, friend. I'm Youzhong from Peking University People's Hospital, Beijing, China. So I think that we experienced the very impressive years from the early of these years, and we met the COVID-19. And fortunately, in China, and so it's outbreak in Wuhan, Hubei province. So I went to there, and in the early of the February and the March and the April, and what I'm very impressive is that we need to as quickly as possible to control the outbreak, to flatten the curve, and then we'll minimize our medical health system's burden. And the second thing is a training, a standard training, so we can treat the patient as simple as possible. All of the protocol should be as simple as possible, and all of the technique, including the ventilation, non-invasive and invasive, should be standard. So that's Peter Saffer tell us. And simple and standard is very important for COVID-19 therapy in critical care area. Thanks.
Hello, I'm Zhang Zhen, an ICU physician from Shanghai Jiahui International Hospital in China. I'm here with my ICU colleagues, Dr. Jie Zhao, Dr. Yang Ang. 2020 was a difficult year for our country and all nations. The novel coronavirus becomes a global pandemic and impacts all nations. We keep on trying to overcome it by sharing knowledge and mutual support.
As physicians in the intensive care unit, we are one of the last lines of care for patients with critical illness. During this pandemic, we were preparing with our hospital system and city, not only for our role in the coronavirus response, but also for continuing critical care needs of all other patients.
Helped by sound medicine, new innovations, and vaccines, we see a light at the end of the tunnel. But through the many lives lost and lessons learned, we hope to continue with the shared global expertise and knowledge in advancing critical care medicine. We send our best wishes for a safer and healthier 2021 from Shanghai Jiahui International Hospital.
大家新年好。
Hi, I'm Akash Deep. I'm a pediatric intensivist at King's College Hospital in London. We had heard about the devastating experience of our Spanish and Italian colleagues during this COVID-19 pandemic, and we were expecting a similar unprecedented demand on our adult critical care beds in the UK as well. At King's College in London, we are one of the largest adult critical care centres, and in PICU, we do a lot of liver transplant work and neurosciences work. So we started to prepare for the surge. We first cancelled our elective surgery. We then started looking for various areas in the hospital where adults could be catered for. And in PICU, we decided to create a hybrid model, a model which would care for both critically sick children and adults on the same unit by the same staff. So we ring-fenced 25% of our beds for our liver transplant and neurosciences work and gave the remaining 75% to our adult colleagues. An intense program of education began for our nursing and our medical staff so that they can confidently and competently take care for both the cohort of children on the same unit. But what came was a surprise about a renal replacement. At any one given point in time at King's, we had more than 500 patients who were COVID positive. 120, 130 were in critical care, and of them 60 to 70 were requiring renal replacement therapy. What worked was teamwork, collaboration, looking after each other, well-being hubs, and that is what I would take with me. The flexibility to work with each other, the ability to taking care of each other and working collaboratively as a team. Thank you.
Hello, my name is Ignacio Martin Loeches, and I am a consultant in intensive care medicine, a professor in intensive care medicine in Trinity College in the city of Dublin in Ireland. So the first question is, how has COVID-19 affected my country? So I have to say that my country was hit by COVID-19 pretty much in the first wave. We had many admissions. It was not totally overwhelmed, but it put the system under huge pressure. So this affected my organization, the way that we had to integrate and to coordinate very differently. We had to invest in search plans. And of course, that included to work more hours and with more intensity. So the biggest lesson learned from COVID-19 is preparedness. I think that we have realized that intensive care medicine is a very important area of providing clinical care. And at the same time, I think that something that has been brought by this pandemic is that we have realized that we need to work together. So we have seen very good research coming from different parts of the world and also in the same country. So working together, we are stronger.
Hello, my name is Jalali Anan. I'm an intensivist working at Raymond Poincaré hospitals in the west suburb of Paris and belonging to the University of Versailles. So as you may know, France now has more than 2.5 million cases of COVID-19, and about 60,000 people have died from COVID-19. We are facing the second heat, and with a number of cases increasing on a daily basis now again, with more ICU admission the past 2 days than the past 2 weeks. So definitely we are in a very strange period of time. In spite of all measures taken by the country at the national level, the epidemic remains not controlled at all. Hopefully the vaccination that is coming now will help putting an end to this pandemic. I think that what the main conclusion I draw from now is that we were definitely not prepared for such a pandemic, and that.
Hello, my name is Arzu Topeli. I'm a professor of medicine and the director of the Medical Intensive Care Unit in Hacettepe University Faculty of Medicine, Ankara, Turkey. Like almost every country in the world, we have been fighting with COVID-19 in Turkey for the last 10 months. And this was a very tough time for us. In Turkey, we have enough hospitals, enough beds, enough intensive care units, equipment, ventilators, medications, etc. But we have very severe shortage of intensive care professionals. So we are really very tired. And in addition, we are under pressure of providing suboptimal care to our patients. We are sad of losing some of our colleagues in our units. So it was a very difficult time for us. I think that COVID-19 could be an opportunity for us to teach the world that intensive care medicine is a very unique specialty. We as societies, intensivists should unite, should collaborate to tell the world that intensive care medicine is very unique and it should be promoted in the world. And I hope 2021 would serve for this. I wish all the intensive care community a very healthy and a very happy new year. Thank you so much.
My name is Dr. Ron Daniels, and I'm an intensive care consultant, a physician working at University Hospitals Birmingham in Birmingham, England, United Kingdom. I'm going to talk about the way this pandemic has affected myself and my colleagues and our organisation. And it started with the preparedness phase, learning how this was affecting colleagues in Wuhan and then Italy and then London, and knowing this was about to hit Birmingham. Unprecedented levels of organisation and preparedness, resulting in the fact that we were almost prepared for this pandemic to hit. And boy, did it hit hard. But the great thing was colleagues from all disciplines, nursing staff, medical staff, allied health professionals coming together, rolling up their sleeves, staff working in alien environments to them, theatre staff working in intensive care, all pulling together in the good of our patients. And now, as we move through the second and third waves of this pandemic, and hopefully can begin to look forward to a time when the pandemic is largely over and the condition has become endemic, we need to understand the scars that this has brought, the physical and mental toll on health professionals, both from the illness itself and from the stresses of working during it. Governments, countries, professional societies, and individuals need to work together to support each other, because the road ahead is hard.
Dear friends and colleagues, I'm Jozef Kesecioglu, past president of European Society of Intensive Care Medicine and Intensivist in University Medical Center Utrecht, the Netherlands. With COVID-19 impact on more than 200 countries throughout the world, we had a year behind us with a lot of difficulties. We had shortages in medicine, equipments, PPEs, and especially in healthcare professionals. We tried to find solutions in impossible circumstances. One issue to keep in mind has been our behavior. We have been excellent in being reactive and finding quick solutions to facilitate care, changing our state of mind to help more and more COVID-19 victims. However, we, the public, have to be more proactive in prevention during the last 12 months. A real massive pressure was on the hospitals and intensive care units. But hospitals and intensive care units are the last line of defense, and the solution is not at the doors of hospitals or intensive care units. The prevention starts with the people at home, in the family, at work, in the street, in complying with the preventive measures in order to achieve the desired effect in controlling the pandemics. Thank you, and I wish you a fantastic Congress.
My name is Marlies Ostermann, and I work in London, UK. COVID-19 has affected the lives of everybody, whether they are patients, healthcare professionals, or the general public. Despite the high mortality rate and the tragic impact on people's lives, a few good things have come out and important lessons have been learned. Firstly, among the society, there's a much greater understanding and awareness of the role of critical care and its potential limitations. Among healthcare professionals, we've learned to appreciate collaboration and mutual aid, in particular when resources are limited. And lastly, the role of clinical research and data gathering and knowledge sharing has never been as important as now when facing an illness which is new to all of us.
I'm Atagi, presented from Japan. Right now, I'm working in the intensive care unit in Nara. Nara is a rural city close to Osaka and Kyoto. Nara is influenced by the number of COVID-19 cases by Osaka. Since Nara is a rural area, there are not so many hospitals. Therefore, we cannot concentrate on the management of severe cases of COVID-19. We need to manage the non-COVID-19 critically ill patients as well. Also, before this pandemic, we could not imagine the shortage of materials and healthcare providers. Therefore, it is very confusing to us to cope with limited material and healthcare providers. It isn't easy to unify the management and the field in the hospital in such situation. Japan has been attacked by natural disasters such as earthquakes and tsunamis. Still, it has become clear that we are not adequately prepared for the long-term disaster like this pandemic. We need to learn from this experience and build a new medical system in Japan. Also, I hope this pandemic will be brought under control soon and get back our daily lives.